What is the impacts of traction on the healing process for acute conditions? So traction can aid in healing process for acute conditions by reducing the pain on affected tissues, promoting circulation, and decreasing muscular spasms. Acute disc injuries respond better to traction than chronic. The process of traction is by gently elongating or stretching the spine or joints. It helps create space between compressed structures like bony protuberances and vertebral disc protrusions. That in turn can reduce the pressure and allow for rehydration of the disc. It can also help reduce inflammation on the nerve roots and allow for better nutrition and oxygen to flow in the injured area because there isn't any of that impingement that's preventing it from being received. And then lastly, traction helps with the muscular spasms by reducing muscular contracture. That's then by elongating them, therefore decreasing the pressure on the spinal nerve by increasing the diameter of the intervertebral foramen. So with all those together combined, that's how traction is used to help aid in the healing process for acute conditions. It helps kind of decongest the area that is being struggling. And however, it's also noted though that you don't want to use it for anything like vertebral fractures or dislocations, and if the patient is presenting with like hypermobile joints. How does traction impact pain management and nerve impingement and disc herniations? Well, like mentioned earlier, traction helps with pain management of especially nerve impingement and disc herniations because the pulling apart of that congestion kind of helps free up those nerve endings so that pressure isn't coming down and sending signals. Traction helps reduce specifically like disc herniations or protrusions. It helps separate the vertebral vertebrae and creates like a negative pressure. So when you pull pressure, when you pull the spine apart, it relieves that pressure on the inside. So during the day, the discs get dehydrated, so they shrink further and compress. And so when you pull it apart, it creates that negative pressure, and so it causes the nucleus, how do you say it, pulsus, to retreat away from the spinal nerve roots. So it kind of sucks itself back in. So it therefore kind of is secondary to helping with pain management because the discs become rehydrated and no longer are impacting those nerve impingements because they're no longer squishing to protrude out. Where was it? It also increases intervertebral space. It helps relieve those nerve compressions, reducing symptoms, and it can help with reducing inflammation and facilitate the healing because it's helping prevent that congestion, and so you're pulling that pain signal away from the nerve because of the compression, and so it allows for them to break that pain spasm cycle cell, and so it can start the actual continuing the healing. Question 3 was impact of myofascial decompression on the healing process. So myofascial decompression, also known as cupping, helps facilitate the healing by improving blood flow, reducing any fascial adhesions, and promoting lymphatic drainage, kind of like kickstarting the healing process, the acute inflammatory process. So this is done again by causing the inflammatory process of capillary hemorrhaging and a fibroblastic response to reactivating the healing process. This is done when you place the cup on the skin. It creates a vacuum seal, and so it's a negative pressure away from the skin, so it kind of pulls all of the muscle, fascia, and muscle apart by also increasing the blood flow to those areas. that then promotes the lymphatic drainage by increasing the blood flow, so the exchange of nutrients through the lymphatic capillaries in the area happen. This process helps, again, facilitate that healing process, again, by bringing active inflammation to that area so that it kickstarts it, so that there's the body has a natural way of recovering, and brings oxygen and nutrients to the area that may have issues from scar tissue or adhesions. And afterwards, the key point of though is the elongating or stretching the muscles afterwards, so that circulation continues to happen throughout the whole entire body. Lastly, the impact of myofascial decompression on pain. So myofascial decompression effectively reduces pain by relieving muscle tensions, improving circulation, and decreasing fascial restrictions like mentioned prior. The restrictions that fascia may cause can limit range of motion for individuals or compress down onto the nerve root endings, which can cause or elicit pain. The cups, again, help stimulate the sensory nerves by promoting blood flow so that the pressure on those nerve endings are decreased. And then again helps with the congestion within the area, so the blood flow and helps limit that. The cups help stimulate sensory nerves, but also promote blood flow, so that, I already stated that. There were two types of pain that myofascial could target. So there was like a mechanical pain and a chemical pain. Mechanical pain is where they reduce it through, pain is reduced via muscle spasms, or chemical pain, which is decreased through the release of opiates that interrupt the pain cycle. But the primary effects of myofascial decompression on pain is that it is derived through the stimulation of the cutaneous sensory receptors, which are activated via the spinal gate. And so overall, a combination of blood flow and lymphatic drainage and edema reduction and help elicit the inflammatory response and free those nerve endings, release those opiates back down to block that pain, help block that pain signal, or interrupt it at least, so that the healing can occur throughout the area.